8-year-old with a history of severe autism. She's running a fever but is otherwise baseline, per mom.
All right, you have your scenario, so let's go ahead and get started. Grab your cheat sheets. Remember, whatever you're using, whether it's Brasillo tape or hand heavy, red goes to the head and measure to the heel. And you can see clearly this child falls into the zone. And now to Scott for your quick tip.
So autism. Autism, you remember, by many is best described as being on a spectrum. And the spectrum means at one end of the spectrum, you've got your child with severe autism, whereas they are not only developmentally delayed, but in the worst cases, they're also nonverbal, non-interactive, flapping and rocking in the corner. At the other end of the spectrum is classically what's described as Asperger's. And a child with Asperger's many times is best described as being a little quirky. And when it comes to these kids specifically, many times if you ask mom or dad, just simply ask them what is the child into. Because not always, but many times they're, quote, into something. Whether it could be Cars to the Beatles to 1950s sci-fi movies. Whatever it might be, if you find whatever they are into and you start to talk to them about that, you will have a great experience while caring for them, and you'll come away far more enlightened in regards to that particular topic. Because I guarantee they know more about that topic than you do. But when it comes to autism, again, it's described as a spectrum from nonverbal flapping and rocking to the other extreme of, quote, just a little quirky. But as a rule, when you take care of any child with special needs, and specifically when it comes to kids like this, remember that mom, dad, and or the caregiver are the experts. Because they are with this child far more than you would ever care to be. Therefore, ask them what works. What works to calm this child down? What works to get a procedure done? What's going to set them off? Remember, in many cases, ritual and routine are everything. So, specifically when you've got a child that's, quote, on the spectrum, simply ask Mom.